All right, this is Dr. Eunice. I am going to continue with the schizophrenia spectrum and psychotic disorders, and I am looking at, we're going to be looking at the schizophrenia disorder. And at the end of this video, I'm going to explain the difference between the other two that I have covered and this one. So schizophrenia is also a chronic, obviously, and severe mental disorder that is characterized by symptoms such as delusions, hallucinations, disorganized speech, disorganized behavior, negative symptoms. So we're looking at what you're looking at right now. You're looking at the first symptom. So these symptoms have to last, at least two of these symptoms have to last for at least 6 months. Okay, so this is going to be the difference between when you're trying to differentiate between schizophrenia and the other disorders that fall under that group. So let's look at delusions again. Delusions are false beliefs that are firmly held despite evidence to the contrary. So this example is of Sarah, who firmly believes that she's a spy working for undercover, for maybe FBI, for a secret government agency, or DCI in Kenya, FBI in the US. Despite having no evidence to support this belief, so Sarah holds that belief as if it's true, and so she may become paranoid and have, of course, just distrust to anyone around her, because she's fearing that somebody is going to betray her, and she's going to be punished by the government that she's working for undercover. So hallucinations involve perceiving things that aren't actually present. For instance, we're going to talk about David. David frequently hears voices that are whispering. Some of the voices might be good, some of the voices might be insults or threats that could cause harm, as his belief that they could cause harm. And obviously they are causing harm because they are insults. And of course they distress David very much and make it difficult for him to concentrate in school, in work, whatever he is supposed to be doing. And then, of course, the symptom is the disorganized thinking or speech. So someone who has disorganized thinking, or their cognition is disorganized, is characterized by fragmented or illogical thoughts patterns. So John or David or Sarah may exhibit this thinking characteristics when they speak in a way that it is very difficult for others to understand what they're saying. So people use you might want to try to listen to what they are saying, but you really can't understand even the story of their hearing voices. It's not correlated. They will jump from one topic to the other, so there is no coherence. So you can say that what they are saying and what they are thinking is totally different. So disorganized or abnormal motor behavior, again, this is also a symptom that has been seen in the other two disorders. It's disorganized or abnormal motor behavior may manifest as unpredictable or purposeless movements. So David, again, displays catatonic behavior, remain motionless for a long period of time. And they also might exhibit repetitive stereotyped movements with no apparent purpose. And so because this is most likely maybe going to be an adult, sometimes, you might think that it is autism because of the repetitive behavior or movement. And then, of course, the other symptom is negative symptoms. Negative symptoms might refer to decreased or absence of normal behavior or functions. David might be experiencing negative symptoms of schizophrenia, he struggles to find any joy or pleasure in any of the activities that he or she used to enjoy before. There might be withdrawal from social interactions, and also have difficulty expressing emotions or even maintaining personal hygiene. So when you think about the differences between the diagnosis that we have talked about, the brief psychotic disorder, it's in the other video, and also the schizophreniform disorder. The difference is that because of the duration. So let me go back and summarize what brief disorder really is. It is obviously categorized by the sudden onset. So this is in the beginning of psychotic symptoms, the hallucinations, the delusions, the disorganized speech, the grossly disorganized catatonic behavior. The symptoms last for at least 1 day, but less than a month. So obviously somebody might be able to go back to their baseline functioning. So consider David, who experienced a sudden and intense episode of psychosis. Maybe it is a traumatic event that happened. Maybe there was a death in the family, and then David was hearing the voices and they were commanding him to harm himself. After a few weeks of treatment, psychotherapy, medication, David might actually go back to his normal functionality, and those symptoms might disappear. And so that's what it's called, the brief psychotic disorder. If David's symptoms do not disappear after 1 month, or they are not within that 1 month range, it is going to develop to schizophreniform. These are hard words for me to say. Schizophreniform disorder. So the schizophreniform disorder is going to share the same symptoms, and the difference between psychotic disorder and this disorder is the shortness of the duration for the psychotic. So this one is characterized by the presence of all the symptoms, but lasting for at least 1 month, but less than 6 months. So it is in the range of 1 month to 6 months. So David, who began experiencing hallucinations, delusions, along with disorganized speech and behavior, these symptoms might only last within that duration. If the symptoms progress and they do not end at that duration of 6 months, that's when now it is going to be under the category of schizophrenia. So schizophrenia, I'm from Nyeri. I am having a very hard time, saying the R and the, all the so this one is severe and chronic, because obviously it has surpassed the 6 months duration. The same symptoms are going to be experienced, but they are going to persist after 6 months or longer, and they must significantly impair David's or Sarah's or John's daily life activities. So for example, if they impact his relationship with his family or friends, and it's impacting how they take care of themselves, the self-care, the hygiene, attending school or work, so they do not have the ability to function, or their daily functions are affected, that definitely it exemplifies the presence of schizophrenia disorder. So it is very, very important that we understand the differences, especially if you're going to be taking an exam soon, or sometimes we have to come up with this provisional diagnosis when we see a client the first time. So if, depending on how long they have had the symptoms, you can definitely now start looking for how to assess for this disorder. So you need to recognize the differences between psychotic disorder, schizophreniform disorder, and schizophrenia. So I hope that you understand again I am getting this information from DSM-5TR. It is the diagnostic manual, statistical manual that we use by APA. Obviously, it's research-based. It is version 5, and of course, the text revision. And I hope that you also understand that this is not a diagnostic procedure. This is for academic or test preparation purposes only, for my students who are in clinical psychology, for people who are doing MFT and they have to remember these symptoms just in case they show up in an exam. I wish you all the best, and thank you very much for listening.